What's going on, everyone? It's Alex here from Aleks Physio. So today we're going to be chatting a little bit about, is exercise safe if you're pregnant? So let's get right into it. There was a guideline that was written more than 20 years ago by the American College of OBGYNs for exercise during pregnancy and the postpartum period. And it states that it would be appropriate for individuals to exercise 30 or more minutes of moderate intensity activity on most and preferably all days of the week at an intensity of 3 to 5 METs. METs stands for metabolic equivalence. Many people wonder about the safety and concern about affecting the health of the baby, in which the guidelines do exercise caution for exercise in two specific categories: to ideally avoid contact sports and scuba diving. So before all individuals who are pregnant start exercising and do what they're doing before pregnancy, it's important to be mindful of some contraindications, both absolute and relative, for why exercise may not be the most appropriate based on your specific medical condition. Obviously, this isn't medical advice, so speak to your OBGYN or physician to get more details, but this is just what the paper was generally saying are some restrictions. If you have pregnancy-induced high blood pressure is one, restrictive lung diseases, and there's a few more here in this chart. Other ones to be more cautious of, so these are relative contraindications, are if you have severe anemia, poorly controlled type 1 diabetes, if you're a heavy smoker, if you have preeclampsia, seizures, and chronic bronchitis. And here's a link for the rest of them. Some warning signs to be mindful of to stop exercise include if you're experiencing shortness of breath with exertion, if you're dizzy, if you have headaches, chest pain, muscle weakness, there's decreased fetal movement, and if you have vaginal bleeding. The other thing to be mindful of is after the first trimester, the supine position, or when you're lying on your back, results in obstructing the blood flow return to your heart, and thus it should be avoided as much as possible during rest and also during exercise. Motionless standing was also shown to decrease our cardiac output and should also be avoided if possible. So what kind of exercises do they recommend? So types of exercises should be focused on improving our cardiorespiratory health and fitness, and also strength exercise, which would generally include the same elements compared to a typical strength routine and exercise routine for an individual who is not pregnant. Being mindful though when you are performing this exercise is that you're trying to perform it in a thermo-neutral environment and paying attention to making sure you're well hydrated and that you're not having some of those subjective feelings of heat stress. So in an air-conditioned place or earlier in the morning or late in the evening when it's not super hot outside if you're exercising outside. Of course, you want to discuss this again with your OBGYN or even with your pelvic floor physiotherapist. This is an important addition to your healthcare team during the prenatal and postnatal period to ensure you have a successful delivery and to give you tips and tricks and minimize your risk of other complications. So why am I sharing this? Exercise can help improve your mood, energy level, sleep quality. It can increase your strength. It can help with constipation, help with bloating, help with maintaining weight. It may even reduce the risk of gestational diabetes, and it can improve your postpartum recovery as well, and may even decrease the likelihood of having postpartum depression with exercise. And the way you exercise during the pregnancy can shape how you're exercising for the rest of your life. So exercise is obviously important for any individual, but especially important for individuals during their pregnancy. And something to be mindful of is, this report was written over 20 years ago, but there's still a lot of individuals who believe that exercise is harmful. And although there are some contraindications to be mindful of, generally for the majority of the population, this is something that it would not be a concern for them. But of course, everybody's medical history is different, so you need to chat with your family physician and your OBGYN for more details. So there you have it. We went over pregnancy and exercise and the importance of exercise for pregnancy and during pregnancy and after. That can affect the health of you and the baby in a positive and favorable manner. And also we went over some things to be mindful of during exercise, some contraindications relative and absolute, and then just some things to be mindful of to help determine your exercise program. So having a team of healthcare professionals that can include a personal trainer, physiotherapist, pelvic floor physiotherapist, OBGYN, family physician, these individuals each play a niche role in helping to ensure that your pregnancy journey is successful and you have a successful outcome both before, during, and after the delivery. So hopefully you found value in this content and information. If you found value, consider checking out some of my other videos where I discuss various topics that are physio, exercise, and medicine related. How has your pregnancy journey been? Let me know below what has helped, what hasn't, what tips and tricks do you mind sharing for the audience and for anybody watching this video and reading the comments. Until then, we'll see you in the next video. Thanks for watching.